Hello, and thank you for joining us for today's mental health mini-series. My name is Emily Byerman, and I am joined by my colleague, Alex McAlpine. We are both registered health professionals who are members of the AMDSB Mental Health and Wellbeing team. Today, we are going to take some time to discuss anxiety in children and youth. Our hope is that following this presentation, you'll be able to recognize the signs when your child is distressed and have the information needed to connect your child with the appropriate mental health support. We will also be offering strategies to support your child's mental health at home.
It is important that we start by defining what anxiety is to ensure we have common language and mutual understanding of it. There are many types of anxiety. However, the most common form of anxiety is classified as generalized anxiety disorder, or GAD. According to the Diagnostics and Statistics Manual, GAD is characterized by the following: excessive anxiety and worry. There has to be more days present than not, and over the course of at least 6 months, and involves worry about multiple topics. That the worry is difficult to control, and that anxiety and worry are associated with at least 3 of the following: restlessness or feeling keyed up or on edge, being easily fatigued, difficulty concentrating or mind going blank, irritability, muscle tension, or sleep disturbance.
At some level, we will all have experiences with anxiety and even may struggle with managing feeling anxious at times. The experience of anxiety is developmentally normative and a part of growing and maturing as a youth. For children, it is developmentally normal to experience anxiety or fear of specific objects such as animals, monsters, and/or ghosts, of germs, injury, or getting a serious illness, of natural disasters, of traumatic events, or being afraid of performing in front of people such as presentations or talking in front of the class. That fear of performance continues into adolescence. In addition, it is developmentally normative for adolescents to experience anxiety and a deep fear of being rejected by their peer group.
But at some point, your child's behavior may become worrisome, and it's good to know when you should reach out for mental health support. Here are some behavioral signs to look out for: attendance concerns, refusal and/or avoidance to participate in activities, constant reassurance seeking from adults and peers, physical problems such as headaches, stomach aches, and shortness of breath, social issues such as extreme shyness around peers, keeping isolated, not joining in activities or making friends, difficulty paying attention or concentrating, and difficulty falling or staying asleep or sleep disturbed and interrupted sleep. For children, anxiety may present with crying, screaming, and/or tantrums when the child is worried or lashing out at others. For youth, anxiety may present with irritability, mood swings, or use of alcohol or drugs to cope with mood, treating oneself unkindly, being overly critical, doubting one's abilities, and low self-esteem, or social withdrawal from peers.
Just like we experience the emotional state of happiness, sadness, or anger, the experience of anxiety is normal and common. Anxiety is our body's normal reaction to perceived danger. Our team finds it helpful to think of anxiety like an internal alarm system, as the experience of anxiety alerts us to danger and then helps our body prepare to deal with the danger. The experience of anxiety triggers something called the fight, flight, freeze response, also known as the stress response. This automatic response affects our thoughts, body, and behaviors. When faced with a potential threat, your thoughts focus on the danger, your body revs up to help protect you, and you take action. For example, imagine that you're out walking your dog and a skunk pops out of the bushes. You may instantly have thoughts such as, what if it sprays us? This automatic thought helps you identify the potential danger. Your body also reacts, such as your heart beats faster and muscles begin to tense up, which helps you get prepared to protect yourself. And then there may be a change in your behavior, such as remaining very still and hoping the skunk doesn't notice you, which is the freeze response, or running away from the danger, which is the flight response. As you can see, anxiety is there to protect us. Although anxiety protects us in the face of real danger, it can become a problem when it happens a lot, feels pretty intense, causes you distress, prevents you from doing things you would like to or need to, or goes off when there is no real or immediate danger. Example, like a smoke alarm that goes off when you're just making toast.
As a parent, it can be very difficult to watch your child struggle with anxiety. When your children are feeling anxious, it's natural to want to help them feel better. However, by trying to protect children and youth from the things that upset them, you can accidentally and innocently make anxiety worse. The best way to help children and youth to overcome anxiety is to teach them to deal with anxiety as it comes up. With practice, they will be less anxious. Here are some tips to help support your child or adolescent who is struggling. The goal isn't to eliminate the anxiety, but to help the child or youth manage it. The best way to help children overcome anxiety isn't to try to remove the stressor that triggers it. Instead, it is to help children learn to tolerate their anxiety and function as well as they can, even when they're feeling anxious. Try not to avoid places or scenarios because they make a child feel anxious. Helping a child avoid things that they are afraid of may make them feel better in the short term. However, it reinforces the anxiety in the long run. Avoidance increases anxiety, exposure decreases anxiety. Express positive but realistic expectations to your child. You can't promise a child that their fears are unrealistic, but you can express confidence that they're going to be okay and that they will be able to manage it. Over time, this gives children confidence that your expectations are realistic and you're not going to ask them to do something that they can't handle. Respect their feelings, but try not to empower them. This means that you don't want to belittle their fears, but we also don't want to amplify them. The message you want to communicate is, I know that you're scared and that is okay. I'm here and I'm going to help you through this. Don't ask leading questions. Try to ask open-ended questions such as, how are you feeling about the science fair? Instead of leading questions such as, are you worried about the science fair? Don't reinforce the fears. We want to be careful about the messages that our tone of voice and body language send. We should try to avoid sending the message that maybe this is something that you should be afraid of. Encouraging the child or youth to tolerate their anxiety. Trying to encourage children and youth to engage in life and allow for anxiety to take its natural curve is called the habituation curve. This means that anxiety will drop over time as the child or youth continues to have contact with the stressor. Try to keep the anticipatory period short. When a child or youth is feeling afraid of something, the hardest time is really before they do it. For example, if a child is nervous about going to a doctor's appointment, try not to start a discussion about the appointment 2 hours before they have to go, and instead try to keep this time to a minimum. This will limit the time spent in a state of worry or distress. Process alongside the child or youth. Sometimes it helps to talk through what would happen if the child or youth's fear came true and how they would handle it. For some, having a plan can reduce the uncertainty in a healthy, effective way. Try to model healthy ways of handling anxiety. Allowing children and youth to watch and learn from ways in which you cope with anxiety yourself can help them to learn and implement the same strategies. Parents shouldn't pretend that they don't have stress and anxiety, but instead allow their children to see or hear you manage it calmly, tolerate it, and feel good about getting through it.
Another strategy you can use is called the CARD system. The CARD system, comfort, ask, relax, distract, provides groups of strategies that parents can use to help their children cope with stressful situations. Comfort, help your child accept negative thoughts and feelings. Let them know these are normal and will pass. Coach your child to be courageous and to be the boss of their worry. Ask, listen and talk to each other. Ask your child how they are feeling and answer any questions they have honestly. Use words that your child can easily understand and follow their lead. If your child doesn't seem interested or is not ready to talk, that's okay. Tell them they can always come to you if they have questions. Relax. Children see and feel what their parents are doing and often do the same. Model relaxation for your child. Speak to your child in a calm and normal speaking voice. Distract. Try to keep normal routines and limit the amount of time your child focuses on whatever is making them anxious.
Here are some examples of ways you can play your cards. Comfort. Talk with your child about what they can do to cope with anxiety. This increases the sense of control that your child has over their mental health and coping strategies. Empower your child to overcome negative thoughts and feelings. You are stronger than you feel. Validate your child's concerns and feelings. Tell them it's okay to be upset. Avoid focusing on the worry. Limit exposure to media or news. Be mindful of the conversations you have with family members. Create daily routines that give your child predictability and control. Create a comfortable environment for your child and tell your child what you are doing to help. Ask questions. Answer your child's questions using age-appropriate language. Possible questions you can ask your child: what questions do you have? How are you feeling? How can I help you to be more comfortable? What are your friends saying? What fun thing can you do today?
Relax. Do things that your child enjoys to help them feel more secure and connected. Practice taking deep belly breaths with your child. Listen to a mindfulness or relaxation activity and practice together. Practice positive self-talk. For example, this may be hard, but I can get through it. Practice being grateful. Think of 5 things you are grateful for while brushing your teeth. Physical activity is important to help us relax. Play catch, stretch, bike, or go for a walk. And lastly, be flexible and adjust expectations if needed. Distract. Talk about things that are important to your child, such as sports, dancing, or art. Read books, color, draw, do crafts, scrapbook, watch movies, play games, work on puzzles, play outside, play with a favorite toy, or help your child with homework or activity book.
Another resource that you can use to assist with learning and teaching coping strategies is the School Mental Health Ontario website. We encourage you to check out School Mental Health Ontario YouTube channel, where they have created videos to support you and your children with practicing anxiety management skills. Some of the videos they've created include guided breathing exercises, body scans, guided imagery exercises, and progressive muscle relaxation skills.
But what if your child comes to you and is looking for a recommendation for some self-help tools? There are also some apps that can be downloaded onto your child's phone that have been specifically designed to help manage anxiety. The apps are especially useful for youth who are always connected to their devices and need quick access to a skill or mindfulness-based support. Some apps to support anxiety include Mindshift CBT, which is a free, evidence-based anxiety management app created by Anxiety Canada that uses cognitive behavioral therapeutic tools. Clear Fear is a free app to help people face their fears by learning ways to manage their physical responses to anxiety, while also helping to change thoughts, behaviors, and release emotions. Sanvelo is a mobile app developed to help people struggling with stress, anxiety, or depression using mindfulness and CBT skills. Users can listen to guided meditations, learn and practice CBT skills, connect with other users or professionals, and track their mood, thoughts, and habits through the app. What's Up, a mental health app, utilizes tenets from CBT and acceptance commitment therapy. It helps teach coping mechanisms, including grounding exercises and breathing techniques, plus how to recognize distorted thought patterns. Smiling Mind is a meditation app for young people from 7 years up. It is a free web and app-based program designed to help bring balance to young lives. There are tailored programs for different age groups as well. Other additional resources to support anxiety include Anxiety Canada, which offers resources to support children and youth, providing practical strategies and tools to manage anxiety. Bounce Back Ontario is a free guided skill building program managed by the Canadian Mental Health Association. It is designed to help adults and youth 15 plus manage low mood, mild to moderate depression and anxiety, stress, or worry. Participants receive telephone coaching, skill building workbooks, and online videos to help them overcome these symptoms and gain new skills to regain positive mental health. Wellness Together Canada is a free mental health and substance use website to support people across Canada that provides online resources, tools, apps, and connections to trained volunteers and qualified mental health professionals when needed. Together All is a digital peer-to-peer mental health support community that is available 24/7 for individuals over the age of 16.
The mental health and well-being team often connects with parents when they are concerned and not sure what to do to support their child. We've included some resources that we provide parents. Please feel free to share these resources with other parents if you get approached. The first is the School Mental Health Ontario Caregiver Tip Sheet. This tip sheet explores how parents and caregivers can identify if their child might be experiencing a mental health problem. what to look for, and how to access help. Our team finds the WITH CARE abbreviation to be supportive when connecting with parents. WITH looks into accessing change. When did the concern start? Has the concern been going on for some time, i.e. more than 2 weeks? How intense is the concern? Given your child's age and state of development, how serious is the concern at this time on a scale of 1 through 10? What is the timing and how often is it happening? How frequently are you noticing the concern? Is it a change from before? And how is the concern impacting my child in their daily life? Is my child struggling to do schoolwork or even play? Are they less interested in things they used to enjoy? Are they having trouble with eating or sleeping?
The CARE abbreviation involves how parents can help their child manage temporary distress in healthy ways through the care you provide. Here are 4 things for parents to try at home. Practice calm together. Find the awesome in the everyday, including the great outdoors, and model gratitude. Set routines that are easy to follow and include time for fun, connection, and rest. Engage in physical activities. Get outside and let nature soothe your child's spirit.
The Waterloo Region District School Board created a resource for caregivers to accessing support for students with anxiety. In this resource, they provide caregivers with answers to questions such as differentiating between typical experience of anxiety and more debilitating experiences, reviewing some strategies that can support anxiety management, as well as community and online resources that can be supportive.
Our AMDSB website under Mental Health and Wellbeing, we have a variety of resources linked, including SEL strategies for at home. Click on the titles to see the grade-specific resources, AMDSB self-care and mental health strategies at home, Staying in the Zone poster that supports children with naming and coping with emotions, read alouds, and coping strategies for at home.
School is an important place in promoting positive mental health and helping to build student skills and resiliency. What this looks like can vary based on the needs of the student. The first level, Tier 1, is the foundational everyday work school staff do to welcome and include students, to understand them and build knowledge of mental health, to promote mentally healthy habits, and to partner with parents, students, and other staff to create a supportive environment. Most of the mental health work in schools is at this level. The second level, Tier 2, focuses on prevention and early intervention. In every class in school, there will be some students who may need additional support in the classroom. Educators and school staff can help by reinforcing skills and working to remove barriers to learning. School mental health professionals can provide intervention services like counseling at this level. The third level, Tier 3 services, support students requiring more intensive assessment and intervention services. The role of school staff is to help students to access appropriate community or mental health services and to provide needed ongoing care while students are at school. Overall, schools are uniquely positioned for mental health promotion, early identification, prevention, and early intervention services. All school staff work in partnership with community and health partners and are part of a system of care.
We often consider mental health as requiring these tiers of support. When students' needs have moved into Tier 2 or 3, we need to consider community services that can support their needs. For anxiety support, our team would recommend a referral to any of the family health teams in Huron and Perth. They have counselors on staff that can be referred to through a family doctor. This is available for patients of the clinic. Huron Perth Center, this is the lead children's mental health agency. Family Services Perth Huron, which provides counseling for youth up to 25, as well as supports for students with disabilities. And 2 common crisis lines that we suggest are Kids Help Phone that offers both call and text options, as well as the Huron Perth Crisis Line. Share these with your child so they know how to access help when you're not around.
Thank you for joining us today. We hope that today's presentation has provided you with a comprehensive overview of anxiety in children and youth, including the signs and symptoms, and how you as a parent can support your child if they are struggling with anxiety.